Hello everyone and welcome to Your Healthier Choice. I am Dr. Roopnarine and we're coming to you live from our studios at Avalira Heights in San Fernando. Today is Wednesday the 1st of February 2023 and on tonight's program we're going to be discussing kidney health. With me in studio tonight is Dr. Sharda Sharma. Dr. Sharma is a specialist medical officer in internal medicine and nephrology. As usual tonight, guys, our number should come up at the bottom of your screens, and we'll do our very best to answer each and every one of your questions during the program. So, guys, let's talk about our kidneys, and let's say hello to our very special guest, Dr. Sharma. Doc, how are you doing?
Hi, good night.
Pleasure to have you on Your Healthier Choice. Thanks for coming in tonight.
Thanks for having me.
All right, Doc. So, Doc, kidneys in particular is something that we haven't really discussed in the program. Our previous host was a diabetologist.
Right.
And in reference to diabetes, you talk about kidney disease and checking other organs as well. But per se, to give a full hour's attention to kidneys, we haven't done that before in the program. So my first question is, exactly, is kidney disease a big problem in Trinidad? And how would someone know that they have a problem with their kidneys? There's someone sitting at home watching the show tonight. Right. Is there any signs or symptoms that will tell them that, hey, I am having a kidney problem and I need to see a doctor?
Right, yep. So kidney disease is a global problem. Mm-hmm. Chronic kidney disease is becoming one of the foremost NCDs, the non-communicable disorders.
Right.
So worldwide, the prevalence ranges between 10 to 15% of the adult population.
Wow.
So we don't really have data specifically for Trinidad.
Yeah.
We are working on our renal registry.
Yes.
We have some data for the Caribbean, but it is becoming a real big problem.
Right.
Over the last 10 years or so, we have been seeing increasing in the amount of deaths due to chronic kidney disease. So it is becoming a big problem here. And in our population we do have a large incidence of diabetes and hypertension, which are the major risk factors. In terms of the symptoms, so unfortunately there's no specific symptoms that would clue you in that you have kidney disease.
Right.
So as in the early stages, you could actually be completely normal.
Okay.
And unfortunately, it's one of those disorders that when you lose up to 80 to 90% of your kidney function, so you're at that end stage, then you might see some symptoms.
Okay.
And some of the symptoms at that stage would be like generalized fatigue, itching of the skin because now you're accumulating the toxins because you could no longer clean the blood effectively. Shortness of breath, swelling of the legs.
And that's pretty late
stage. That's late stage. So in the early stages, you could actually feel very normal, very well. You hear a lot of patients say that all the time. But I'm feeling well, it's a misconception that they think they must have back pain or something like that. I didn't see any symptoms. I didn't feel anything.
Right.
So it's only at the late stage you could have some of the appearance of the symptoms.
Right. We always hear about kidney failure in Trinidad, right?
Yeah.
People say everybody knows somebody who had kidney failure. And I suppose that's acute and chronic renal failure is a technical term for it.
Yeah.
Can you explain that? What is renal failure?
Right. So renal failure.
Renal meaning kidney.
Yeah.
Right?
Kidney failure is that stage where the kidney function is no longer able to sustain the body's metabolism then. So the kidney is responsible for cleaning the blood, for getting rid of extra sodium, potassium, excess water, maintaining the blood pressure. So kidney failure is that stage where the kidney is no longer able to filter the blood.
Right.
And that's when you have all these symptoms starting to come up.
Right.
In terms of acute and chronic kidney failure, so acute kidney injury is something that happens within hours to the time frame ranges hours to about 7 days.
Okay.
And usually it's things that once identified early can be reversible.
Right.
That's acute kidney injury or kidney failure. So usually it's because of an infection or a decrease in the blood flow to the kidneys.
Right.
So something that's causing the kidney to decrease in the function, leading to an acute state where it is unable to perform the functions.
So other than infections, what else could cause acute kidney failure?
Yeah, so like exposure to like some toxins,
Okay.
drugs,
Okay.
Poisons.
Right,
Yeah.
of course.
So circulation problems, so
Right.
patients with heart failure,
Right.
all those can lead to an acute kidney injury.
Right.
Sometimes when you have blockages for the urine, so
Right.
yeah, so
Right.
for example, those patients with prostate issues
Could lead to kidney
could
problems.
lead to kidney problems. Yeah.
All right, and so that's the acute part. And how do you explain what is chronic renal failure?
Right. So chronic kidney disease is
Yeah.
a progressive loss of kidney function.
Right.
Usually they give a time frame. This progression is happening more than 3 months in duration.
Okay.
And the definitions outlined by the guidelines are based on the kidney function or the glomerular filtration rate being less than 60 mils per minute. So
Right.
once you calculate your glomerular filtration rate, normal is like 90 to 120.
Right.
So if you have a drop in the kidney function, so less than 60,
Yeah.
and that is going on for more than 3 months,
Yeah.
that is categorized as chronic kidney disease.
All right. I recognize that some of that might be difficult for the layman
Yes.
to understand, but those are really calculations that a doctor would
That-
make
yes.
to test their
Based on their blood work
bloods
and
in
stuff.
their blood work. What are the causes? I mean, we all know about diabetes and hypertension, right?
Mm-hmm.
But are there other causes of chronic renal disease that we see commonly, that you would see commonly in your
Yeah.
clinic, in the hospitals,
Yeah.
or in private practice?
So in our population, we do
You can tell
have,
us again about the different ones.
so in our population, we do have high incidence of lupus,
Lupus,
and
okay.
connective tissue diseases.
Yeah.
So patients with lupus would have progression of their kidney disease if the kidney is involved to cause kidney failure. Sometimes you have structural diseases of the kidney, such as cystic kidney disease, that would lead to kidney failure over time,
Right.
and also sickle cell disease in
Yeah.
our population
Yeah.
can lead to kidney disease over time.
Right.
And things like, so it's a big term called glomerulonephritis,
Right.
which is essentially inflammation of the kidneys. So whatever different causes leading
Yeah.
to changes in the kidney,
Yeah.
inflammatory changes,
Yeah.
can lead to kidney failure over time. And then of course the two big ones are diabetes and hypertension.
All right. So one of the big questions I wanted to ask is, we all know, we all hear diabetes could cause kidney failure, high blood pressure could cause kidney failure. But sometimes I think that we need to explain to people what happens so that it can be embedded, so that they can understand why certain things happen and why they should control their chronic diseases.
Yep.
I don't think it really makes sense just to say a phrase and somebody interpret a phrase and that's it.
Yeah.
Sometimes the understanding of how it damages your body is very important.
Exactly.
So can you explain to us in detail, how does high blood pressure, hypertension, cause that kidney failure? What exactly happens to cause that kidney failure?
Right. So hypertension leads to kidney disease over time.
Okay.
So what happens is that the hypertension is essentially high blood pressure. So
Yes.
you have the circulation is affected. Over time, you can have stiffening of the arteries. You can have the blood flow to the kidneys being affected. And the kidneys are very vascular organ, meaning it needs a very big blood supply. So it requires the blood supply to perform its function. So when the blood pressure is very high, it can cause damage to the small blood vessels within the kidney,
Right.
leading to, over time, a loss of the kidney function, because you have the filtration units in the kidney. Each kidney is made up of about 1 million filtration units, and each requiring a high blood flow to perform its function. So once the blood pressures are excessively high, it affects these filtration units.
How does it affect the filtration?
So you have like scar tissue being
Okay,
laid
okay.
down. You don't have the function being performed, because now you have increased sodium levels because of the hypertension.
Okay.
So it kind of throws off the whole mechanism there, where the kidney would be controlling the amount of sodium and potassium in the body.
Okay.
So there's a hormonal type of mechanism as well. So the kidney, the arterial supply is affected, and then over time you have scar tissue, you have shrinking of the kidneys, and then that leads to a loss of function.
Okay. Okay. How big is the kidney?
So the kidney, the normal size ranges from like 9 centimeters to 11 centimeters in length.
Right.
So patients with hypertensive disease,
Yeah.
you could see over time
Yeah.
the kidney gets smaller, and there's a certain pattern on the ultrasound.
Yeah.
So they would tell you that the kidneys are shrunken. So you see usually now at the end stage where you would get the size coming down to like 7 centimeters, 8 centimeters.
So
there's a big
literally
difference.
high blood pressure shrinks the kidneys.
Yeah.
How over what period of time does that happen? Because I mean, if I get diagnosed with high blood pressure today, does that mean I have kidney damage right away?
Right. So that is a very good point. It really happens over time.
Right.
And hypertension is one.
What time frame?
So it depends on the control.
It depends on the person.
Yes.
Right. But
So generally you could see changes after 5 years, 10 years. It might be quicker if the control is not good.
Yeah.
So if you have patients who have blood pressure values that are always outside of the range, you can have that damage happening at a quicker interval.
Right.
Because the blood pressures are not controlled, and we usually tell patients that there's a target blood pressure that we would like you to be in a certain range.
What is that target?
So usually the recommendations is like around 120/80 now.
Right.
It used to be a little bit more flexible before.
It's about 140, 90.
Yeah. So and the diabetics we would aim for like 130/90. So now the guidelines have changed a bit and it's 120/80. Bearing in mind, of course, you can't get strict that kind of control with the elderly patients because you don't want them to have adverse events.
Right. So somebody who's hypertensive, they're at the risk of kidney disease, which causes kidney shrinkage. The hypertension causes kidney shrinkage. This could happen over the space of several years, up to about 5 years. The appropriate blood pressure control, which you are saying could be really have to get it close to 120/80 to avoid any kidney damage.
Yep.
And you're saying that a patient might not know if they don't see a doctor that they have kidney damage because there's not much symptoms that they will have.
Right.
So this is all happening inside of them and they don't realize it's happening.
Yeah.
And they're not going to feel sick necessarily.
They're not going to feel sick.
Until way down the line when it's really a failure of the kidney, and that's when they get obvious symptoms.
Symptoms, correct.
So it's a kind of scenario that you're not getting no knock on the door until the door get kicked in.
Exactly.
Yeah, until it's big problems.
So it's a serious.
So
and then
I could see why we might have problems with high blood with kidney disease in this country as well, and all over the world, because the patient not necessarily going to be sick.
Right.
Until it's too late.
Yes.
Is it too late?
So that's why we advise patients that if you have some of the risk factors, especially diabetes and hypertension, you have your kidney function checked, you discuss the target values with your doctor so you know when you're doing your home measurements what values you're aiming for.
All right.
And then you kind of get familiar with the values, you get familiar with the blood work, and kind of get familiar with
so
what
that's why
is normal.
It's important for people to see the doctor regularly and for doctors to check kidney function.
Yeah.
About diabetes, could you explain to us how diabetes causes kidney failure as well?
Right.
In the same detail that you gave
So
us.
it's a slightly different mechanism.
Right.
Again, it affects the filtration units.
Yeah.
And the kidney is supposed to retain protein, minerals, and certain amount of sodium and potassium for normal body function.
Yeah.
And the kidney filtration unit is made up of many different layers. So you have your blood layer, you have a filter layer, and you have cells that would help retain the things that are needed for normal body function.
Yeah.
Over time, the diabetes, and especially with uncontrolled diabetic levels, it can lead to, again, damage of the filtration units.
Right.
So now you get a lot of protein being spilled into the urine.
Right.
So you're not supposed to have any protein in the urine. So protein in the urine is abnormal.
Right.
And over time, because the filtration units are now leaking protein, leaking things that it should retain, it leads to damage over time.
Right.
And again, you can have scar tissue developing at later stages in the filtration unit itself.
Right, right. So the majority of the patients in this country who have renal failure that you see in the hospitals or going for dialysis are diabetic and hypertensive patients.
Yes.
By far?
Yes, so that is the main two causes.
All right.
So that's globally, regionally as well,
Yeah.
and here locally. Diabetes is the #1 cause.
Okay.
In #1 cause, followed by hypertension.
So you were getting into a brief recommendation there for the patients who are diabetic and hypertensive and how to protect the kidneys in terms of their checkups.
Yeah.
It didn't make sense. It doesn't make sense for somebody to come in when they have all those symptoms that you said, with the legs swelling, can't breathe, itchiness, or if we could get them beforehand.
Correct.
So I want you to tell us what they should do. Obviously, they control the risk factors. Are easy thing to do, to say. Control the diabetes, control the pressure. But people, that's not enough of a guideline, I think,
Yeah.
to tell people how to do it, what
Yeah.
to do.
Yeah.
Can you tell people with these chronic conditions what they should do to protect their kidneys?
Right. So like the diabetic patients,
Yeah.
so sometimes 2 to 5 years before you're actually diagnosed with type 2 diabetes, you start have changes in the organs as a result of fluctuating
2
sugars.
to 5 years before you're diagnosed with diabetes.
Before diagnosed with diabetes. You can't have changes happening before you're formally diagnosed.
Right.
So when you're formally diagnosed now, you're at that point where you're having symptoms of diabetes probably, or you do a routine check.
And the HbA1.
And you do the HbA1c and it's discovered.
Yeah.
But sometimes 2 to 5 years you can have slight changes. You may have changes in the blood sugars that you're not aware of.
Yeah.
So all this time it is causing changes at the kidney level.
Right.
So from the time you're diagnosed with diabetes type 2, it's recommended that you do your kidney function test so you could kind of stage, your doctor will be able to stage what kidney function you are at. Based on the numbers, they can tell you, a different range of stages based on the kidney function.
Of course.
So we tell patients, okay, they kind of want a percentage to work with. So they kind of have an idea, a numerical value that they could say, okay, my kidney function is X%, or
Yeah.
so based on some calculations on the blood work, and then we could tell them, okay, this is the stage of your kidney function, and then we can outline to them, well, these are some of the things that we will be changing. Your A1C value, we want to see around 7. We kind of give them education about the target values for the blood pressure,
And
the sugar levels. The dietitian, we send them, so it's like a multidisciplinary approach. We send them to the dietitian.
How often should someone check the kidney function?
So usually, depending on the stage of the kidney disease.
Right.
Yeah. So
Right.
if it's early stages, you could kind of do like every 6 months.
Right.
Once you kind of assess the patient and they're not falling into a high-risk category,
Yeah.
so you do 6 months, a yearly kind of visit, your
Right.
yearly physical with your blood work.
Yeah.
Patients who have a lower kidney function, then we want to see them more regularly, especially those patients who are approaching end-stage
Right.
kidney failure.
Right.
So you do blood work more regularly, probably like every 3 months, depending on the kidney function.
All right.
So you kind of assess the
Does
patient.
someone's urine tell them much about their kidney function or kidney health?
Yes.
When I say urine, like if they're at their home passing urine in their washroom,
Yes.
is there any indicator of the kidney health there? And at a doctor's office, I mean, traditionally all over the world, you go to a doctor's office, a part of your routine visit, the doctor takes a sample of your urine and checks
Yes.
it. Can you tell us the value? I mean, it's a skill that's been lost a little bit, I think, in
Yes.
general practice. Sometimes you ask, and sometimes people not checking urines as often. Why is it so important for doctors to check patients' urine? And why is it important for patients to look, or people, the public, to look at the urine?
Yeah. So that's an excellent point. So a patient would tell you
Okay.
that they notice in their urine a little frothy.
Yeah.
And then when you come to your general practitioner, when they do the dipstick urine in the office, you might see the presence of protein.
Yes.
So that is an indication that things are happening at the filtration units, as we discussed before.
Right.
So now you can send your patient to actually have a formal test. Once you do that screening, get a formal test done to measure the amount of protein in the urine.
Right.
And that level, again, would help you categorize your patients into
Right.
severe, moderate, mild, affected in terms of the amount of protein in your urine. Because the higher the protein level, the more issues you have, the more damage at the kidney
Would the
level.
person also have blood in their urine?
So sometimes they can see blood in the urine.
Yeah.
Usually that'll be associated more with like kidney stones or something happening in the bladder.
Right.
But what they can tell you is that if they have discoloration of the urine or like dark urine,
Yeah.
they might describe it as it's probably like coke color or
Yeah.
like tea color.
Yeah.
So that is telling you that there's some kind of inflammatory process
Yeah.
happening in the kidney, and you need to see a doctor urgently, because
Right.
that is like an acute kidney injury, as we discussed before,
Yeah.
and something that should be looked at immediately.
All right, Doc. Just whispered in my head that we need to take a little break. All right, so guys, we're here with Dr. Sharma. She's a nephrologist. We're talking about our kidney health. I'd just like to take this opportunity to formally invite you to send in your questions. Join the discussion, give us your comments, your ideas, your opinions. We value it as well. And we'll see you back in one moment.
Hi everyone, I'm Stacy from Stacy's Kitchen. Check out our new episodes, Season 3 of Stacy's Kitchen at our new time, 5:30 p.m. on Mondays and Wednesdays, right here on ACTN The Voice. I will be whipping you up some flavorful and appetizing dishes. As they say, good food makes a good mood. So guys, stay tuned for this culinary explosion right here on Stacy's Kitchen.
Welcome to the Chuttock's Kitchen, where it's tastier and spicier. For even more taste, cook with Chuttock's Amchar Masala, saffron, ground jeera, and black pepper. Mix in Chuttock's mild, spicy or Madras curry. Get a burst of excitement with a mango amchar, pomsade and mango kuchila, lime and pepper chunks, West Indian hot sauce, and lime pepper sauce. Plus, Chuttock's tamarind and mango chutneys are perfect with kalori and sahina. So make your kitchen a Chuttock kitchen. Chuttock's fruit products, bringing good taste to life.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
All right, guys, welcome back. We're here with Dr. Sharma, and we're talking about kidney disease. So feel free to join the discussion. So Doc, just before we went off there for the break, you were telling us about the urine, and you were telling us that sometimes, is it that you said frothy urine?
Yeah, frothy urine. So patients will describe the urine like they see in like froth when they pass urine in the washroom.
That could help indicate the presence of high protein.
Protein, yes.
Okay.
So not every patient would get that, eh?
Yeah, yes. Of course not.
So, but
And
they
not
would,
every frothy urine is going to provide high protein.
Exactly.
Right. And
But
then the doctor dipsticks it in his
yeah,
office.
so once you see that you get a positive dipstick for protein, you send the patient now to get quantification of the urine. So how much protein is present in this urine?
Yeah.
So you could classify your patient into mild, moderate, severe risk. Because the higher the protein in the urine, the higher the risk of the patient for progression to kidney disease.
All right.
And then, of course, you look at the blood values, you look at the urine tests, and then you look at the ultrasound.
Right.
So all these three parameters would help you assess your kidney function.
Right.
And then you could again categorize your patients.
Okay. I
So
understand.
the guidelines would tell you, you would hear patients would come and say, Doc, what stage am I at? You know,
Yeah.
am I end stage? Am I stage 1, stage 2? So the guidelines categorize patients stage 1 to 5
Okay.
based on the kidney function tests.
Okay.
So your doctor would work out that for you in the
Right.
office
Right.
and then put you at a level,
Right.
a stage.
All right, so I'm going to take that's one sort of sideline question before we move on. How about water?
Yeah.
How important is water to kidney health? And could it cause kidney problems, lack of water?
Yeah.
And I mean, it's a real simple question, but how much water should we drink?
Yes.
Officially.
I get that question all the time in the office, especially in our climate.
Yes.
So again, it depends on the range of the kidney function.
Yes.
So normal kidney function, normal water intake for our climate could range anywhere between 1.5 liters of fluid to 2 liters a day.
Right.
You're passing urine normal. If you're working outside, you're drinking more. You know, once you pass in urine, there's no issues there. As we start to get down into the lower kidney functions now.
1.5 to 2 liters, you said?
Yeah, per day, for 24
so that's
hours.
how much I should be drinking?
Yeah.
Okay.
That's a 24-hour
Water.
period. And that includes all fluid.
All fluid?
All fluid. So that's a
That's
kind
not
of...
too much.
No, that's a, you could achieve that easily in a day.
But why is water important to kidney health?
So the water tends to, just like flush the system then, right?
Right.
So when you drink water, the filtration units...
flush my system too. I could drink 2 liters.
Yeah, but you're not really getting hydrated
So why
with
would I
that.
drink water and not
So
beer?
yeah, you're hydrating your system now, right?
Right.
So things like alcohol
dehydrates you.
Right. So because the kidney has to work a little extra hard now to filter those things.
I understand.
So with water now, you're able to kind of flush the system.
Right.
You get the toxins moving out.
Right.
You get the extra salt, extra potassium.
Right.
Any byproduct of protein metabolism, everything kind of flush from the system with water.
So the consequence of that is lack of water causes accumulation of these toxins?
So lack of water leads to dehydration.
Yes.
And your kidney has to work a little harder now to conserve water, to maintain your body metabolism.
Right.
So sometimes you could get a little imbalance in the salts in the blood if it's excessive dehydration, which we see in our patients when they have like a diarrhea illness or acute illness. Sometimes the salts in the blood become a little like out of balance then, yeah? And so then you notice certain changes happening, and then sometimes the kidney function itself will, as we say, take a hit. It kind of decreases because of the dehydration.
Yeah, hydration status is extremely important, especially, I mean, I think Trinidadians probably blew in the ears from here and blew in the face from here, and doctors said, you had to drink more water, right?
Yeah.
I think Trinidad is, people joke on how say, all the doctors tell me to take Panadol and drink water.
And drink water. Yeah. So that's...
But that's real great advice, right?
Yeah.
It's not that we trained to say take Panadol for everything and drink water. But it's especially relevant to Trinidad.
Yeah.
And it's especially relevant to Trinidad more so because I practice in different countries. But hydration is extremely relevant to help you get better, right? No matter how much interventions you do, how much fantastic medications we give you, if you're not hydrated, you're not going to feel better.
Yeah.
And you're not going to recover, whether it's a minor illness like a virus or a flu. You cannot recover well, or you take longer to recover unless the hydration status is good.
Because it affects your circulation as well.
It affects everything.
Yeah.
That brings me to another point. Is there, as the doctor says take Panadol, right? But the doctor sometimes says take Panadol because he's not only wants to help you feel better, but he wants to make sure you're safe.
That's an important point.
A lot of the medications we use and people take over the counter or may get their hands onto, or the neighbor might give them, might not necessarily be safe for them.
Yes.
And there's actually a common usage of medications that we thought in the past was safe to just take over the counter that we're learning might not be so safe.
Yes.
So could you discuss that role of people taking medications and kidney disease, or even wider into your field as an internal medicine doctor?
Yeah. So especially the pain meds that are over the counter. So this class called the non-steroidal anti-inflammatory drugs.
Yeah.
So more commonly the ibuprofens and that type of medication.
You could give the chemical name, but not the brands.
Yeah.
Yeah.
So that class. Yeah. Those type of drugs.
Yeah.
So that over time again leads to kidney damage.
Yeah.
Much in the same mechanism where it affects the blood supply over time.
Yeah.
It can cause narrowing of the arteries supplying blood to the kidney.
Yeah.
It can cause an inflammatory response in the kidney,
Yeah.
cause white cells to enter the kidney and lead to scar tissue and damage over time.
Yeah.
And sometimes those are not
abused,
yes,
or overused drugs in Trinidad, aren't they?
yes. And sometimes those changes are not reversible if not detected early. So if you continue to use these class of drugs over time, it leads to scar tissue of the kidney,
Yeah.
and then you see that shrinkage in size and
Yeah.
then progression of end stage kidney
Yeah.
disease.
And sometimes, correct me if I'm wrong, sometimes you could get acute renal failure, sometimes from overuse, if you take a big amount, of these NSAIDs.
Yeah.
And it's something that is widely available and people widely use in Trinidad. Sometimes people just pop them, take them very often.
Because
so
you
we
could
have to be very careful.
get them anywhere, and they work well, right?
They
so
work fantastic.
so people, it is working from a pain, and I will continue to take this. Some patients say this is the only way I could walk around at home when I
Yeah.
take these drugs because it helps with the pain.
So what advice would you give them?
So usually,
Because they're right.
Yeah.
And people want to be pain free.
Yeah.
But then you coming on the TV now and telling everybody, be careful you take it because you're going to damage your kidney.
You're going to damage your kidney. So
And then the rest of them give them a Panadol.
So there are other classes of drugs that you can use that wouldn't have the same effect
Okay.
on the kidney as these non-steroidals.
So how I commonly approach it, right? Especially people with joint pains, and you could correct me if you think it's a good way. I tend to use a lot of topicals now, right? Because I've learned, which I didn't realize in the past, that topical medication actually do help joint pains, right? I never used to think, well, how could a little gel on somebody's finger joint go down to the bone and help them?
Yeah.
But the inflammatory process of a joint pain actually goes all the way up into the surrounding tissues and muscles, and actually gels do contribute to helping.
Yes.
Right?
Yes.
So I usually begin with those gels because they're safe. They're not going to be absorbed into the kidneys.
Yes.
And then I would move forward to, paracetamol and Panadol, for the simple reason that it's a kind of sort of baseline and safer option. And it also provides a pathway, it hits one pathway of pain relief.
Yep.
And then I would go on to tell the patient, at least we've tried and we've given it the benefit of the basic medications to give you relief. And if these basic medications are giving you relief, well then we've won the battle without compromising your health. Because everything you put in your mouth has a consequence. And then I would tell them if they're still getting pain, well then they could go ahead and use maybe the NSAID, right? But we'd use it sparingly.
Yeah.
And we'd only use it on those days that we have bad pain, but we're not necessarily going to use it at a course for 3 times a day.
Yeah.
Already paper in the booklet and everything tells you could, because they're trying to reduce their risk of kidney damage.
And
is that a reasonable approach?
No, that is, because you use the non-steroids, but you use it supervised.
Supervised.
Yeah.
Carefully.
So you have a time frame that you want to give the patient this, because I mean, you're not going to say, okay, you can't use this drug ever again.
Yeah.
But then you have to look at the stage in kidney disease too. So it's not going to be suitable for the patients with lower kidney function.
Right.
But those patients who like in the in-between stages and it's a supervised course, so you give them like a 5-day course, and you monitor the dose, and you use the paracetamol in conjunction with it.
Why is paracetamol safer? Is it safer?
It is metabolized by the liver,
Right.
so no kidney interaction there.
Okay.
So it's not going to have any issues with kidney function and lower kidney function.
Right. So a lot of medications are metabolized via the kidney?
Via the kidney, yeah.
Okay. And the NSAIDs are one of those?
And the NSAIDs are one of those.
Okay, well that explains it even more.
Yeah.
And that also leads us to how we kind of sort of met over the phone.
Yes.
Because we were discussing a medication for a patient who had kidney compromise, and I had to give him some medication to help his problem. So I consulted with you, and you told me what dose to do. So is it that people with kidney problems have to take lower doses of medications? How does that go?
Especially with antibiotics.
Right. Which is what we discussed on the phone.
So usually you're accustomed to a specific dose that you would give a patient a specific course. That changes with kidney disease, and especially the patients who are on dialysis, where you might have to decrease the dose even further.
Right.
So based again on the kidney function, and when you classify the patient, there are recommendations for the dosages based on the kidney function.
Right.
So a lower kidney function, a general rule is you might see doctors half the dose of the usual course then.
Yeah.
So that way it's safe for the patient.
Yeah.
So you don't get accumulation and you don't get more side effects then.
Yeah. So when somebody has kidney problems, or even somebody who has hypertension or diabetes, we have to be really careful with other medications we give them, because we don't know if it's going to cause, if it's going to accumulate in the kidney.
Yeah.
Right. So I mean, the big topic that we sort of skirted around and we need to get into is, what is dialysis?
Yep.
We hear the term all the time.
Yes.
We know the dialysis wards are busy.
Yes.
We know the nurses are fantastic, and we know the doctors know everything about the patient, and we know the patients spend hours on end there.
Yes.
So tell us, what is dialysis, where it's done, and what happens.
Okay. So dialysis is a treatment that we offer to patients when the kidney function goes below, say, 15%. We have this marker where we would classify you as end-stage kidney disease.
Yeah.
And then we offer the patients dialysis based on their symptoms. So they're not all going to start dialysis at this cutoff for end stage then.
Okay.
So it might vary.
It's not only a figure.
Yeah,
it has
it's to with the symptoms as well.
Taken.
Correct.
Right.
So sometimes you might have patients with a percentage of 8 or 9 in terms of the kidney, but they're not really having so much symptoms. So we kind of see what is happening with the patient, because it's a holistic kind of assessment as well.
Right.
So you assess the patient based on the kidney function and then the symptoms.
Yeah.
And dialysis is really taking over the cleaning aspect. So the kidneys are responsible for cleaning the blood.
Yeah.
When the kidney function is less than 15%, it's no longer able to clean the blood effectively.
Okay.
So dialysis now takes over that function. So a machine now and an artificial filter cleans the blood. Okay. So there are 2 forms of dialysis.
Yeah.
So what you mentioned is the hemodialysis, or the blood dialysis as patients would refer to it.
Yeah.
Where you go to a dialysis center.
Yes.
And you have a treatment that can range from 3 to 4 hours.
Right.
And that is done 3 times a week.
Okay.
So the patient is in the unit.
Yeah.
The nurses would set up the machine.
Yeah.
And then the patient is attached to this machine for that 3-hour, 4-hour interval.
Right.
So the blood flows through the machine and passes through a filter.
Right.
And this filter takes out the toxins, takes out extra fluid, balances the potassium, balances the sodium, and then essentially clean filtered blood comes back into the patient.
Right.
So this happens over a process of about 3 to 4 hours.
Yeah.
And then at the end of it, the treatment is completed, patient goes home, and then has to come back another day, another appointment.
All right. Doc, now is a good time for us to take a little break,
Yep.
second commercial break. All right, guys, so we have Dr. Sharma, and we're going to take a quick break.
Doesn't scare me, it's not big enough. I'll never be the same. Never, never, never. I'll never be the same. In Jesus' name.
Connect with ACTN The Voice on Facebook or Instagram at ACTN The Voice.
ACTN The Voice, your family-friendly station.
All right, guys, welcome back. My name is Dr. Roopnarine, and I'm here with Dr. Sharma. We're talking about kidney disease, and I'd just like to invite you to send in your questions on the topic. So, Doc, you were telling me that the patient comes in for dialysis. It's to clean the blood because the kidney isn't functioning properly to get rid of the toxins. It's a machine with a filter, artificial filter. They're hooked up to it for about 3 to 4 hours a day, and it probably goes about 3 times a week. And then after that, the patient goes home after the 3 to 4 hours. And the toxins, that the role of the kidney has been done by this artificial machine.
Yes.
And that is called what type of dialysis?
That is hemodialysis.
Hemodialysis. And there's another type of dialysis?
There's another type of dialysis, which is called peritoneal dialysis.
Yes.
So this dialysis can be done at home.
Right.
So you're in the comfort of your home, surrounded by your family. So you're a little bit more flexible now. So you don't have a schedule where you have to go to the center. So a lot of patients find it attractive because it allows them to kind of have a daily routine and independence. Correct. So this peritoneal dialysis now, basically it's infusing fluid into the tummy, the belly, and the fluid acts on the peritoneal membrane, so the lining of the intestine then is where the filtration
The peritoneum
happens.
is that sort of
Thin,
fibery, thin white layer around the
intestine.
Intestine,
So the fluid sits there for about 4 hours, 4 to 6 hours on average, and over this time you have that exchange taking place where extra fluid and the salts are balanced and toxins are removed from the body. So it's a more gentler process because it doesn't involve direct contact with blood. So this happens over about 4 to 6 hours. So the patient can move around at home, interact with their family, while they're having dialysis. And at the end of the treatment time, you empty the fluid, and then you have to put in another set of fluid in there. So it's like a continuous process then. There are different forms of the peritoneal one where you could put in the fluid yourself, or you can do it overnight where a machine infuses the fluid and takes it out while you're asleep, so that during the day you don't have to do any exchange.
People think that kidney failure and dialysis is only for old people. Is that true?
So that is a misconception, yes, a common process, a thought process in our population. It can affect anybody. It depends. You would see more the older people being affected because of the chronic diseases, diabetes and hypertension, but like the inflammatory causes, cystic kidney disease, lupus, sickle cell, they can affect younger patients. Sometimes you don't even know what the causes the patient presents, and you kind of have to speculate if this could be some of the causes here, but they're already at end stage. So we have dialysis patients in their 20s all the way up to like over 65. We have some teenagers as well. And I'm sure the pediatric doctors could give you feedback about the pediatric age group, but we do have is across the board, from kids all the way up to elderly.
And the dialysis units or dialysis, is that the playground of the nephrologist? Is that your ward? Is that your turf? That's your turf?
Yes.
So you spend the majority of your day there?
So yes, in dialysis unit and then on the wards, because we have like basically 2 arms of patient then. The chronic kidney disease patients, so those are the clinic patients where we try to put things in place to delay the progression to end-stage kidney disease.
And
then we have the end-stage kidney patients who are on dialysis. And those are the patients requiring treatment 3 times a week or the peritoneal dialysis.
Can people go from dialysis and kidney failure back to normal kidney health? Is that a possibility? Does it ever happen? Or is it such a progress that once you've reached destruction at this stage, it's, I'm sorry, but you have to be on dialysis and that's no other option?
So
I'm sure people ask you that question.
Yep, that is a common question. Unfortunately, it is a progressive disease. And once it's chronic kidney disease, there is no room for reversibility. So it's a progressive thing that would, over time, get to end-stage kidney disease.
Yeah.
The only treatment that allows you to be dialysis-free is a kidney transplant,
Right.
where you don't have to do the dialysis anymore because now you have a new kidney.
Yeah.
So somebody donates a kidney to you,
Yeah.
or you get it when you're on the list, so
Yeah.
like a deceased donor, meaning a
Yeah.
kidney from a person who has died,
Yeah.
or your friend or family would have donated a kidney to you. That's the only treatment that would allow you to be off of dialysis, but you still have to be on medication and being monitored.
Right.
So you wouldn't necessarily go back to having a label of no kidney disease. It's just now you have kidney disease, but you're in a different category.
All right. So dialysis could be pretty life limiting. No?
Yeah, yeah. Especially
Because if you have to go in, is it minimum is 3 times a week?
3 times a week.
So patients who have kidney disease, right? I mean, this might sound a real simplistic question, and excuse me for that. But their ability to conduct daily activities in life is really hampered.
Yes.
And I mean, people go away for holidays, people travel, people go abroad for exams. Can kidney patients on dialysis do this? Do these things?
Yes.
How do they go about doing it? Because if I have to go to New York for 6 weeks for my study course or something, and I'm on dialysis, so to visit my family, how do I go about doing that?
Yeah. So it is, once they diagnose
That's
it,
a question I'm sure you get.
yeah,
from
you get it all the
patients.
time because patients are, of course, they get this diagnosis now.
And they
is
think that they're limited. They
life-changing.
think they're chained to
Yeah.
to you.
Yeah. So your whole life now becomes structured around this dialysis unit and schedule.
Yes.
So you have other aspects of your life. You have work, you have family,
Yeah.
you have recreational, you have traveling.
Yeah.
All that is affected
Yeah.
in the acute setting when you're now transitioning, right?
Right.
So it takes a little while for the patients to come to terms and settle down.
Yeah.
But in terms of travel and stuff,
Yeah.
everything just has to be planned really well.
Okay.
So we do have patients who visit and who visit other countries.
Yeah.
So we have to get information from their dialysis unit, or we send information to wherever the patient is visiting.
Yeah.
So for example, if patient wants to travel to New York,
Yeah.
they would make contact with a dialysis unit there. We
Right.
send a medical report, we
Right.
send blood work,
Right.
and the patient now, when the patient goes,
Yeah.
they have continued
Okay.
their dialysis schedule.
Okay. So I suppose you, not necessarily you, but you being the kidney field of nephrologists, you all have great international relationships.
Yes,
Yeah.
we do.
Okay, I suppose everybody's speaking to everyone on a regular
So
basis.
yeah, it's more like, we would send reports, or we get
Yeah.
reports, and
Yeah.
so it's like a standard thing.
Right.
And then the peritoneal dialysis,
Those people could travel easily.
yeah,
easier.
the supply, they have mechanisms set up in each country then that you
Right.
could get your fluid supply, and
Right. Or you could travel with
and you
it.
could travel with your
So would you move a patient from hemodialysis to peritoneal dialysis in order to facilitate movement or lifestyle?
So patients can switch from one form of dialysis based on lifestyle. So there
Yeah.
are patients who may have started off on peritoneal dialysis, and then they would switch to hemo for different reasons.
All right.
Whether it's infection of the hemodialysis catheter or non-functioning catheter, it may be necessary to switch.
Okay.
Yeah, so it is once patients kind of start, there is always that
All right.
that room for
So,
switching.
so Doc, I invited the public to send in their questions, and I hug in the limelight. I will not give them a chance. So Josh tells me we have about 4 questions. So Josh, you could go ahead, please. Can you explain uric acid of 7 and GFR of 54, which is classified as stage 2? I suppose that's somebody giving you a blood result,
a blood
right?
result, yeah.
Can you explain uric acid of 7 and GFR of 54, which is that classified as stage 2? Or is
No, that would actually be that is less than 60.
that
So
uric
yeah.
acid of 7 is high, is it? I can't remember.
So it's
Yeah,
borderline,
it's
yeah,
high.
yeah.
A GFR of, that's a glomerular filtration rate.
Yeah, so the
of
GFR of 54, so that patient has chronic kidney disease by definition is less than
Right.
60 mils
So-
per minute.
I'll jump in there, Doc. I mean, that's basically a blood result. really, blood results need to be taken into consideration with the person. As you said, you really mentioned highly that nephrology is due to symptoms as well. I mean, the figures mean a lot, but they don't mean that much.
Yeah.
And you certainly do not have the privy to see that person in front of your face.
Exactly.
But you did give an explanation. You said GFR is the glomerular filtration rate. 54 is normally a little bit lower than it should be. Uric acid at 7 is borderline. And I think really that, you know, people that clinical skill of seeing a patient and checking them is of great value rather than just reading
yes.
blood
But there may other reasons
so,
for the uric acid.
Yeah, so I really don't want to put you too much on the spot and compromise you there, but I think you gave enough information to that question. Josh? How good is the pro-renal supplement? That's a good question. I didn't touch on that, and I should have, and we were discussing it during the break. But this person is talking about supplementation to protect the kidney.
Yes.
And I would like to add to that question, is there any foods that cause kidney problems, and is there any foods that can help give us kidney health?
Right. So taking the question first,
Yes.
Pro-renal is one of those supplements available on the market.
Yeah.
A combination of iron, folic acid, vitamins, minerals,
Yeah.
and it is geared towards patients with a lower kidney function.
Right.
So rather than going to the pharmacy and getting a multivitamin off the counter,
Yeah.
this pro-renal supplement is made especially for that population of patients.
Right.
So it has a little bit of vitamin D, some calcium.
Okay.
So kind of like a multivitamin for kidney patients then.
Right.
And usually the patients who are classified as chronic kidney disease would take the supplement.
Okay, so you're pretty much saying, yeah, it's
a good supplement.
It's a good supplement. So is it that as a renal doctor that you give patients supplements?
So part of the kidney function is to maintain the vitamin D levels,
Yeah.
calcium.
Yeah. So I suppose if you
the,
check the bloods and you see
Yeah.
variation, you're there.
it helps with the blood count. So when you have a decrease in kidney function, you
Yeah.
would get things like anemia,
Yeah.
low calcium.
I understand.
So you would have to supplement these things
Okay.
now because the kidney is not able to do that part of the function that it would do before.
So I think you answered that view really well there. You said like, yeah, it's fine. But the other part of my question is there any foods or supplements that we can use other than to boost our kidney health if we do not have a kidney problem, like that
Right.
gentleman alluded to there?
Right. So in terms of specific foods, I mean, you try to do a balanced diet and not have highly processed stuff because that's not good for general health
Yeah.
and it's not good for kidney health.
Right.
Especially foods with a lot of preservatives, additives, a lot of salt.
Yeah.
So no food specifically would lead to kidney health. So it's more about balancing your diet
Avoidance of bad ones.
and tailoring your diet according to the kidney function.
Okay.
So you're looking at doing a low salt,
Right.
which would help with your hypertension as well.
Right.
You're looking at doing a low potassium
Yeah.
and a low phosphorus.
All right.
So these are some of the things you have to target because the kidney is responsible for balancing these things in the blood. And when the kidney function falls, the potassium accumulates and can lead to dangerous effects with the heart. The phosphorus accumulates and can lead to a decline in bone health.
Okay.
So you have to kind of now cut back on the things that would be super rich in potassium and the phosphorus.
Okay.
So it's important for the dietitian now, you sit with the dietitian, and then of course taking into consideration whether you're a vegetarian or you have certain dietary restrictions
Right.
because of
So
religion
they
and
still
whatever.
hang that thing over the bed in the hospital, renal diet.
Yeah, yeah.
So how about protein? What protein does that cause? Like meat? Does meat
Yeah.
cause problems with your kidneys?
Yes, it does. So the recommendation is you still need a certain amount of protein for normal
Yeah.
body function.
Yeah.
Manage, for your skeletal muscles and
Yeah.
general health. But too much protein is not a good thing, right?
Yeah.
The kidney has to now work harder to get rid of the metabolism from protein.
Yeah.
So the protein, when it's broken down, you would get like nitrogen and urea, and these are the things that are removed by the kidneys.
Okay.
So when these things accumulate in the blood,
Cause problem.
you have more work then,
So
so
you
more work on the kidney.
So a kidney diet is low in, a renal diet is low in protein.
So they kind of
Balance it.
they balance it. So it based on your weight.
Right.
They calculate the amount of protein that you should have
Right.
based on your weight, and so everything is tailored individually then.
Okay. Yeah, Josh, sorry about that. You can put me next question. what does a GFR 65 under stage 2 mean? So a lot of times, sometimes people go and do blood tests all over the country, right? And sometimes I think the machine or something gives them
generates
a report.
Yeah.
That sometimes causes a little bit of angst.
Yes.
In the population.
Yes, because you're looking at this numerical value alone.
And you never even went in for that, the doctor just told. So what?
So it's a lab-generated value based on the blood work and your age.
Yeah.
So sometimes the value that it's given may actually be normal for your age group because you have to factor in that as well.
Yeah.
So just by looking at the value, you can't really make a comment on the kidney health.
Yeah.
And then, you know, we didn't get any whether the patient diabetic or hypertensive and other things to explain the value that we're seeing.
And kidney checking kidney stuff is really a lot of bloods, but it's more than just doing a GFR reading from a machine. There's other values that you look for as well.
Yeah.
We have about 3 more minutes, so Josh, you'll put forward the next question there for me. Can you explain the uric acid of 7? Is that high, low, normal?
I think it's like borderline.
Borderline,
yeah.
6 to 6.7.
Yeah.
Is high uric acid dangerous to kidney health?
So you can see a high uric acid at lower levels of kidney function.
Yeah.
Especially in some of those patients that would suffer with gout arthritis.
Right.
So this is where the uric acid level is very high and you might get like it affecting certain joints.
Right.
So at lower levels of kidney function, the uric acid can build up in the blood because, it's one of those things in the body that is metabolized and excreted through the kidneys.
Yeah.
So the values can go up.
Yeah.
So just based on that alone, you can't really comment too much because you don't know what the patient's diet is like.
Yeah.
Because uric acid, you can get it in red meat and stuff like that as well.
All right. Josh, do you have any other questions? Right, we have a question coming in. Josh just read it out to me. Does menopause have any impact on kidneys?
No, not really a strong association then.
Right.
So that would lead to other symptoms, but it wouldn't really affect your kidney health.
All right. Any other question you got there, Josh? No? All right, so that's just to wrap up, Doc. A really important question that I wanted to ask is, why and when should someone see a nephrologist? I'm not talking about the end game.
Yeah.
Because, I mean, from what you described here tonight, I think it's basically here and here. Here is big problems and renal failure. But certainly if we could get people before they reach here, before they reach end stage renal failure, is where we win the battle.
Yes.
And I think sometimes as doctors and when we're doing blood tests and stuff, we might catch people here just before. When is it important to get people under specialized nephrology care?
Yes.
Because certainly I think you would agree with me, sometimes people are only going to see the nephrologist when it's here.
When they get sick, yeah.
So you don't want to be seeing people only when they're getting dialysis.
Yeah.
Because not everybody in the world is your patient before that.
Yeah.
So when should us as community physicians, when should us as a community, as patients, going to see, hey, I need to see a nephrologist?
So if you have any of the risk factors that we discussed before, it's always good, if you haven't checked your kidney function, to go in and get that function checked. If you're following up with your doctor, your family physician, and the family physician sees a decline in kidney function, meaning there's a change in the blood work from one interval to the next, you send that patient for evaluation by the kidney specialist. If you notice protein in the urine in the office, or if the patient has this any discoloration or frothiness in the urine, get a kidney doctor checked out. Okay. And then the aim is really to prevent that progression. We want to catch patients where we could administer in intervals medication and protective effects so that patients can you delay the progression to end stage end. So the patients, even though they have kidney disease, we want them living well.
Yeah, we want to slow that.
We're slowing that process.
Yeah. So Doc, we're all out of time. I'd just like to thank you for coming in tonight to the studio to discuss the topic with the patients at home. We met really on short notice. It was literally a phone call. patients spoke, I mean, it's the truth. The man was literally hopping off the seat, happy that I was actually talking to you, because she said that you're fantastic, you're so approachable, and Dr. Robin wanted to talk to her about it, and I was like, wow, all right, let's talk to her about the show. So I'd just like to thank you, one, for being so amenable to talking to me and coming onto the program and being willing to share your knowledge to help other people. And two, I'd just like to compliment you with such wonderful relationships with your kidney patients. It's such an open relationship when people really need help, and people are really at the lowest, and it's nice to see that, you know, and I compliment you on that as a fellow colleague and medical professional.
Thank you very much for having me and giving me the opportunity to be here tonight. Thank you for your kind words.
No problem, no problem. All right, guys, so I'd like to thank Dr. Sharma again, and to remind you, people have been asking, that all our episodes, all our guests for the last year and more are available on YouTube. So you just go up to our YouTube, it's ACTN, Your Health, Your Choice, and you type in the topic that you'd like to view, and up will pop the guest and my discussion with them. All right, so we have a long archive. I think for the last year we've done over 42 shows, so you could look back at any topic that you'd like and continue your education on your own. All right, guys. So thanks very much for joining us tonight. Thanks for your comments, and we will see you again next week. All right, guys, so God bless. Take care of yourself now, and we'll see you again. Take care now, guys.